Let's talk about something called Guillain-Barré syndrome. It's a pretty rare condition, but it's built on a truly terrifying idea. What if the very system that's supposed to protect you, your immune system, suddenly decided you were the enemy? It's a powerful and honestly a kind of scary look at how our own bodies work.
And this is where it gets really strange. It starts with a question that sounds like it's straight out of a medical thriller. How can something as ordinary as a stomach bug, a simple case of food poisoning, somehow trigger a massive neurological crisis that can literally leave a person unable to move? That's the central mystery we're going to unpack.
You see, what's so wild about this whole thing is that it doesn't start with some rare, exotic disease. Nope. The journey into Guillain-Barré almost always kicks off with a super common illness, the kind of thing most of us would just get over in a few days and forget all about. And when you look at the list of culprits, it's stuff we've all heard of. We're talking about a GI bug like Campylobacter, the one you can get from undercooked chicken, or even the Epstein-Barr virus, the one that causes mono. And here's the kicker. The attack on the nerves doesn't happen during the infection. It happens 1 to 4 weeks after you think you're totally recovered. So you think you're in the clear. The flu's gone, the stomach bug is over, story's finished. But that's exactly when the real problem starts. Your body's internal security system, your immune system, gets its wires crossed and makes this just catastrophic mistake.
And that mistake has a name: Guillain-Barré syndrome. At its very core, it is an immune-mediated attack on your own nerves. Let me put it another way. It's not some outside germ causing the nerve damage. It's friendly fire. Your own body's defenses are the ones pulling the trigger.
So how on earth does this happen? Well, it's a classic case of mistaken identity. There's a scientific term for it: molecular mimicry. See, your immune system builds these incredible antibodies to fight off that initial bug, but through a terrible twist of fate, certain parts of that bacteria or virus look almost identical to the coating on your own nerve cells. The antibodies, they can't tell the difference, and they start attacking your nerves with the same ferocity they used on the invader.
And this attack, it can go down in two main ways. Think of your nerve like an electrical wire. In the most common form of GBS, the immune system strips the insulation. That's the protective myelin sheath around the nerve. In other forms, it's even more direct. It cuts the wire itself, damaging the core fiber, the axon. Either way, the electrical signal just can't get through. So what does this feel like for the person going through it? It usually starts with a strange tingling or weakness in the legs. It's symmetrical, meaning it happens on both sides at the same time. And then it starts to climb, moving up the body. For doctors, one of the biggest clues is a loss of reflexes. They tap your knee with that little hammer and nothing, no kick. That quick ascending weakness is a huge red flag. Which brings us to the diagnosis. As soon as doctors see these signs, it becomes a race against time. They have to figure out if it's GBS for sure and rule out a bunch of other things that can look similar. It's real-life medical detective work. Now, one of the most important pieces of evidence they look for isn't in the blood. It's in the cerebrospinal fluid. That's the liquid that surrounds your brain and your spinal cord. To get a sample, they have to do a lumbar puncture or a spinal tap. And in that fluid, the first thing they find is that the protein level is really, really high. That's a sign that nerves somewhere are being damaged and are leaking protein into the fluid.
But then, and this is the twist, they check the white blood cell count in that same fluid, and it's completely normal. And that combination is super important because a high cell count would suggest an infection in the nervous system, like meningitis. But a normal count means something else is going on.
This specific, very strange combination has a really long name: albuminocytologic dissociation, but you can just think of it as the smoking gun for Guillain-Barré. It tells doctors there's nerve damage happening, but the fight isn't in the central nervous system itself, it's happening out in the peripheral nerves.
So the spinal fluid provides a huge clue, but doctors can also investigate even more directly. They can actually test the nerves themselves to see how well they're conducting electricity, almost like an electrician checking the wiring in your house. These tests are called nerve conduction studies, and they can show exactly what kind of damage is happening. If the signal's really slow, it means the insulation is stripped. If the signal is weak or just completely blocked, it means the wire itself is cut. This doesn't just help confirm the diagnosis, it tells them which type of GBS they're dealing with. Okay, so once the diagnosis is looking likely, everything kicks into high gear. This is not a wait-and-see kind of illness. Guillain-Barré is a full-blown medical emergency, and patients are admitted to the hospital right away for some very, very serious reasons.
Here's why it's so urgent. The paralysis can keep ascending. If it reaches the diaphragm, the main muscle you use to breathe, you can't breathe on your own. About 20 to 30% of patients, nearly 1 in 3, end up needing a ventilator to breathe for them. On top of that, it can mess with your autonomic nervous system, causing your heart rate and blood pressure to swing wildly and dangerously. That's why patients need to be in an ICU, constantly monitored.
At this point, the goal of treatment isn't to repair the nerves. That's a problem for later. The immediate #1 job is to get the immune system to just stop. It's all about calling off the attack as quickly as humanly possible.
And there are 2 main ways to do this, and studies show they're both equally good at it. The first is IVIG. Doctors basically flood your system with healthy antibodies from donors, which helps dilute and distract your own antibodies that are causing the problem. The other option is plasma exchange, or PLEX. You can think of this one like an oil change for your blood. It physically removes the patient's blood, filters out the bad antibodies, and returns the clean blood back to the body.
Now, it's also really important to mention what doesn't work. In a lot of autoimmune diseases, the go-to treatment is corticosteroids, steroids, to calm the immune system down. But the evidence is really clear here. In classic GBS, for some reason, they just are not effective when used by themselves. So after the attack is stopped and the patient's vitals are stable, the final phase begins. And it's by far the longest one, recovery. You have to understand this is a slow, gradual process. It is absolutely a marathon, not a sprint.
The journey usually follows a predictable pattern. For the first 1 to 4 weeks, the symptoms get worse until they hit their lowest point, called the nadir. Then things stabilize in a plateau phase that can last for weeks or even months. And from there, over many, many months, sometimes even years, the nerves slowly begin to heal and function starts to come back, almost always with a ton of intensive physical therapy.
So, after all that, what's the long-term outlook? Well, despite how severe the illness is, the prognosis is actually quite hopeful. The vast majority, around 80% of people, will be able to walk independently again. But about 20% are left with some lingering weakness. And tragically, because of potential complications, the condition is fatal in about 3 to 7% of cases.
In the end, Guillain-Barré is just this dramatic, powerful reminder of the razor-thin line our immune system has to walk every single day between protecting us and, well, attacking us. It's a case of mistaken identity with absolutely devastating consequences. And it really makes you wonder, doesn't it? What other mysteries are still hiding inside our own immune system, just waiting for us to figure them out?